What I wanted to share a little bit is, as I journey with people during their time of bereavement, some of what we see are people who say, if I'd only known, when they ask me, do you want us to feed your mom? Well, I thought, why wouldn't I want you to feed my mom? But you forgot to tell me that that meant she'd be on this feeding tube for the next 3 years of her life and non-responsive, and I wasn't sure she really wanted that. And so that person struggled with that in their time of grief, to know, did I make these right decisions? And on the other hand, I've had people say, I was so relieved. I had to make some really tough decisions at the end here. But thank goodness my dad filled out his wishes. He filled out 5 wishes or an end-of-life statement in A Durable Power of Healthcare. And so they were tough choices, but they weren't mine. They were the ones he chose. And so I was honoring his choices. And it sure made life easier. And probably the third scenario I often see are people who said, I don't want to go out of this world the way my husband did. It was really a tough journey. I want to make sure I have some quality of life. I want to make sure that people know what I want. And I want to make sure that happens. And so sometimes part of their grief journey is actually filling out their own durable power of healthcare and making those wishes known, not simply on paper, but sharing them with family members and their doctor and all the people that need to know that information. So that's just a little bit of a picture of some of the things that I see in relation to this issue.
Well, this is one of the issues in being here this evening, that the difficulty of talking about end-of-life issues is that it's probably one of the most complex, complicated things that we can't. I find that people want to try to put everything in a nice box and the same thing works for everybody, but it really doesn't. And especially as a healthcare provider, I come to find that everybody is so different in every situation, even if it seems similar in another one, that there's no way to have one standard way of doing things. I mean, there truly is an art to helping patients and their families get through, not only helping them to make decisions about where are things going, how would we like things to proceed, and what can we expect, but the unknown, the variations, the differences of everybody is what makes it really a true art form. We're blessed to actually be able to work with a whole bunch of people that this is what they do all the time, have these conversations. As Barb was saying, I think that certainly one point I would like to get across this evening is that it's so important to have those conversations amongst yourselves on what would you want for yourself, what would family members want towards the end of their lives, and think about that and have those conversations with your physician. The physicians aren't the ones typically bringing up these kind of issues. They really should, but it's not comfortable stuff. But saving those decisions to a time when you're in crisis mode is the worst of time. Those kind of decisions. And that's what we commonly deal with. And so I would certainly encourage everybody to, again, have those conversations. 5 Wishes document, which I use regularly and hand them to all my friends, who think I'm a little odd, but I think it's something like that. Just talking to people, letting people know what you want. That's an important thing to, especially with holidays coming up, people getting together. I would really encourage all of you to do that, to have those conversations, even though they aren't fun conversations, they're necessary conversations.